Okay, so we are live. So good evening, New Zion. I am your host for this evening, Yolanda Henderson. And with us, we have Nasha Snipes and Dr. Jennifer McBride from Cabarrus County Health Alliance. And they are going to share some information with us. And we're going to have a really good discussion on should we take the COVID vaccine. So you can actually start submitting your questions right now to the church Facebook page, and I'll get those questions answered. And so for right now, what I'm going to do is just turn it over to Nasha, and we are ready to go. So Nasha, have it.
Okay. Hi, everyone. Again, my name is Nasha Snipes, and Jennifer and I both work for Cabarrus Health Alliance, as Yolanda stated. And what I want to do is I want to share about sort of like the disparity right now with the African American population and how the vaccinations are affecting
I think she froze.
You're back. You're back. Elma's
Am I
screen's
back?
Yeah,
flashing.
you froze.
Okay.
You
Elma's
I
froze.
screen.
okay, so I saw my internet went out for a second. I was like, oh, this is good. All right. So, I mean, we know historically we make up less than half of the population. But however, we're usually hit the hardest when it comes to diseases or any type of diseases. So what I want to do is I want to actually start off just by sharing my screen. I want to share a website that I found. This is actually from Kaiser. One second. Can you see my screen?
It's coming. Yes.
Okay, so this is actually from Kaiser, and the title of it is go up to this is the latest data on COVID-19 vaccinations, and it's broken down by race and ethnicity. Now, this was published in May 26th, so that was what, about a week ago, correct?
Right.
Okay, so I'm thinking that this information comes out probably once a week, maybe every 2 weeks. The great thing about this is it separates us by ethnicity, and also it separates by state. So here at the top, you have the percent of vaccinations, the percent of cases, the percentage of deaths, and the percent of total population. When we go down to North Carolina, we see that we have 18% are vaccinated. Okay. We make up 20% of the total cases of the state. However, our percentage of death is 26%. So, and lastly, out of the total population, we are only 21%. So those numbers right there are very concerning. And we know a lot of it has to do with comorbidities. So that's things like high blood pressure, hypertension, diabetes, prediabetes, and just a list and host of, stress, other things. But these numbers are very telling, and it shows that we actually need to do something. Stop sharing my screen. And I don't know,
Okay.
can you
You're
see
no
me now?
longer sharing.
Okay.
Yes, we can see you now.
Okay. So that's the main thing, just to show like where we are and why this is important. Now, today we're not here to force or sway, but we do want to give you the information and be able to answer the questions, which is one of the reasons why I have my colleague with me, Dr. McBride. Lovingly, we call her Jennifer, because she really breaks the information down and doesn't. Again, we're not promoting anything. We're not sponsored by any of the vaccines or anything, but we just want to give you the information. I mean, historically, I know sometimes with vaccinations, we've gotten the bad end of the stick, right? But you have heard with this one, we've actually had a seat at the table, excuse me. So there were African Americans actually involved with the vaccination. I know some of the other concerns was like, oh, it came out so fast, right? we had the disease and then next week we had a vaccination. Jennifer can speak more to that scientifically of what happened behind the scenes that laymen weren't privy to. And it makes a lot of sense. So just want everybody to open their hearts and minds. If you're here, probably are, but also give you information so that you can actually share it with your loved ones and with other people that do have questions. Right? And from there, I want to actually turn it over to Jennifer.
All right. Thank you, Nasha. Hi. Yes. Again, my name is Jennifer McBride. I am a colleague of Nasha at the Cabarrus Health Alliance, which I don't know why it's named Health Alliance. It's the Cabarrus Health Department. I still need to find that out. I say that every time I say the name, and I still don't know why. But I do first off want to say thank you so much for having me. I've been looking forward to this. I've been so excited for this all week. So yeah, a little bit about, I don't know, I feel like COVID at the beginning was such a shock, and for everybody, nobody knew what was going on. Right. The news wasn't doing a good job, if you want my honest opinion, of really giving the information out to everybody. So hopefully I can answer any questions that you may have to help make you feel more comfortable with whatever decision you want to make for yourself. Not here to convince you of anything, just like Nasha said, knowledge is power, and I hope that I can, again, lessen any confusion or hesitancy or anything like that that anyone might have. And or if you get a friend or a family member or someone out in your community asking you a question, you can answer that for them and give them that same information. So before I kind of talk about, I'd say, hot topics that I hear about often, do you have any questions yet?
No, I don't see any as of yet.
Okay.
I have two people monitoring them, so I haven't seen any as of yet. So you can go ahead.
Okay, I just wanted to make sure. So some of the things that at the beginning that people were very concerned about in terms of the COVID-19 vaccine was how quickly it came to be. And yes, it did. It seemed to come out of nowhere, just like COVID did. One thing that, for those of you who do remember 20 plus years ago, probably about now, there was an outbreak of SARS. So SARS is related in the same family. It's like the sibling of the COVID virus, of the coronavirus, in the same family of viruses. So since SARS came to be and became an issue, a global issue, research and medicine and the scientific community have been studying SARS. So when COVID happened, both the virus and the vaccine, the scientific community wasn't starting at zero. They had some working knowledge off of SARS, very, very, very similar to the coronavirus. There are some differences, but at least they had a really nice platform and a place to begin. So yes, it's new, it came quickly, but for the researchers and the scientific community, it wasn't as quickly as we felt it out in the community. So they were prepared in a way to begin without even realizing it. They were doing work on it many years prior to COVID coming out. Also, in terms of its speed, just speaking candidly, it is amazing what our community, both small and large, can do when everybody focuses on the same thing, focusing our energy, our time, and probably, unfortunately, more importantly, financially. So companies, government, everybody, as they should have, threw money at the same concern. And it is amazing how much we can accomplish in what we feel is a short amount of time when we all have the same goal, which was figuring out what COVID was, then coming up with a vaccine, helping people who do contract COVID to successfully get through that, right? So again, it was quickly, but if you put that SARS along with everyone's focus being the same thing, the timeline tends to feel makes a little bit more sense, I'll say.
Okay.
So
That does make that actually does make a lot of sense, Dr. McBride. One of the questions or concerns I hear a lot is the vaccinations are not FDA approved. And so you see things on the news that say, Pfizer has requested approval for the FDA or Moderna has requested approval, and people are hesitant because they're saying, should I take something that has not been approved?
Yes. And that thought and concern is completely understandable because that is what we know. Unless it's FDA approved, we don't know if it's good or bad, right? Like that has been our benchmark our entire lives on just about everything, whether it's FDA, USDA for food, that's what we have been taught is our standard. So yes, the thing I will say to that is both Moderna and Pfizer did long clinical trials with a very large number of people. They had tens of thousands of people in those studies. So in order to be able to get that emergency use authorization, that EUA, those two companies had to do a lot of work to even get that EUA. So to get FDA approval, like formal approval, it can take a very, very long time because there's a lot of red tape, there's a lot of paperwork. It's meant to be a difficult process, right? Because we want to make sure that things that are FDA approved are good. They're clear.
Right.
We know what they are. We know that they're good or bad. Mm-hmm. The EUA is a sped up version of that approval. I would argue those trials that were completed were done in such a way that they are and will be FDA approved. It's the paperwork.
Okay.
Everything in government takes forever. I mean, I hate to say it.
Yeah.
So
we're actually starting to get some questions coming in.
Okay,
and
good.
One
Awesome.
is, as a parent, should I allow my teenagers to take the vaccine? Or so what is it now? Kids 12 and up or 16 and up can get the vaccine?
12 now. It's 12 and
Okay.
up. Yeah.
12 and up.
Okay, so what? Okay.
Oh, go ahead. I'm sorry. Go ahead.
No, I was just going to say, can you speak to kids 12 and up getting the vaccine?
Sure. Yeah. So both Moderna and Pfizer started adding in younger demographics, children, bit by bit. So that's why so Pfizer originally was approved for 16 and up, while Moderna was originally approved for 18 and up. So when they had completed more data and had distributed more vaccine, both Pfizer and Moderna were like, okay, let's go a little bit younger now. Because at the beginning of COVID, children weren't the main concern, right? It was our older population. So They have slowly been like, okay, now things have calmed down a little bit. Let's look at children. So they started at 12. They started adding in children to those trials to collect more data. In terms of, from a research perspective, I'll say getting consent or getting an adult to volunteer in a study is difficult. Trying to get children, their parents feeling comfortable, understandably, is probably a lot harder, right? It's one thing to do something, to volunteer for something yourself, but to volunteer your children is a different story. So both Pfizer and Moderna had to make sure that they had a large enough group of children to make the study worth it. I'll say you have to have a high enough number for it to be statistically significant. So at that point, they had enough in terms of numbers for 12. Things have gone well with those. They continue to, I've read recently that they are going younger and younger, right? They're going to slowly start getting younger and younger as they recruit more parents who are comfortable giving that to their children, including them in those trials. However, so I will be very open. I do not have children. So I can only sympathize. I cannot empathize with giving my child the COVID-19 vaccine, any vaccine, anything that would, right? That's my world. If at any point, my biggest thing is communication. So if you are, or a parent, are interested, I would make sure, if it were me, that my child saw their pediatrician, right? So that you know everything that's going on with them up to that point, and talk with their pediatrician about that specific child and what that pediatrician would recommend. We have seen that the vaccine, Pfizer and Moderna, have been doing very well with the ages of 12 and up, but I can also appreciate wanting to have a trusted ally in that discussion. So instead of going to a vaccination site, right? That's what I mean. Instead of going to your local CVS or something like that, maybe go, now that it's available at doctor's offices, go to the doctor's office and have it done. So that way you can also have any other questions answered at that time.
Second question is, if you have several allergies to medication, how is it known what is in the Moderna or Pfizer vaccine or the Johnson & Johnson? Like, how do you know which vaccine to take if you have allergies?
That's a good question. So Nasha and I have worked at many a vaccine clinic these past several months. Yeah. So there are specific screening questions that you are asked when you go to get your vaccine. The ones that are probably the most common are if you've had an allergic reaction to something, an anaphylactic reaction. So something like a bee sting, or are you allergic to shellfish, or have you had any other type of itchy, swelling type reaction to really anything. Yeah, I remember being like, bee sting, shellfish, and a previous vaccine. Like, those were the questions. So that is one question that they will ask. It does not keep anyone from getting the vaccine. In terms of anaphylactic reaction, they just make sure that they monitor you longer. At all sites, they have EpiPens, they have Benadryl, they ask if you are prescribed or carry an EpiPen. So that is one thing that is probably the most common question that's asked in terms of reactions, right? But in terms of other things that you might be allergic to, so I'm thinking of common prescription medicine allergies, so like penicillin, right? Things that we're more commonly allergic to. Again, I would speak to a doctor, see what they say, because I'm not trying to not answer the question. Every single person is so different. And the level of reaction that one person has, like, let's say I'm allergic to bee stings. So I itch, I get a really bad red spot, it gets raised. Unfortunately, Nasha, she's even more allergic to bees, and she starts getting itching and it feels like her throat is swelling up. So it depends on the individual. But there has not been, I'm like thinking off the top of there has not been much that has stopped completely anyone from getting the vaccine, aside from individuals being severely immunocompromised. So seeking treatment for maybe cancer, right? Actively receiving chemotherapy and radiation. More often than not, it's not that you can't have the vaccine, it's that the level of attention and care might be different.
Okay, and one main thing that I want you to actually clarify that we hear a lot of, and I'm sure it's a huge misconception, is that the vaccine contains the COVID virus. Can you speak to that or dispel that, please?
Yeah, sure. So the Moderna and Pfizer vaccines do not contain any viral DNA or any viral genetic material. So if you can visualize a circle that has spikes sticking out of it, all of the genetic material that virus contains is on the inside of that circle. The spikes that are sticking out from that circle are what the spike protein, the S protein. These are things you probably have read or seen in the news or online or something like that. It's those little spikes, that pieces of them, that are contained in the vaccine. So what the vaccine is actually doing is stopping the virus from being able to attach to our cells, because those spikes are what attach to our cell, which allows the actual virus, the genetic material, to then enter our cells because it's stuck on the inside. Without that attachment occurring, the virus itself can't enter our cells. So the vaccine is just stopping that attachment process.
Okay, and so what's the difference between the Moderna and Pfizer versus the Johnson and Johnson?
Okay, yeah, so Pfizer and Moderna both contain the spike protein. They are mRNA vaccines, which are a new type of vaccine. They've been studied for quite some time. I know that mRNA vaccines have been studied for things like HIV. They have been studied for targeted various cancers. They just haven't been utilized in the sense of, obviously, coronavirus, COVID, because it wasn't there, and all of the other more common concerns, viruses, things like that, that we are vaccinated for. There was already a vaccine, so they weren't focusing on that. So the mRNA vaccine is Pfizer and Moderna. The Johnson and Johnson vaccine, which is a one dose, so you just go one time, it is different. It is more of a traditional vaccine that you've had in the past. So the difference between the Johnson and Johnson vaccine is that instead of using that spike protein, that mRNA, and how it's packaged, it uses a different type of virus, like the circle of a different type of virus, to transmit that information into our body. So the mRNA vaccine, the actual construction is slightly different than Johnson and Johnson. So that's okay. The difference.
So is and other things that are said is like the Johnson and Johnson, because it's one dose, it's stronger, or is it, the efficacy, I'm sure it is the same, but some people, they want to know, why is it 2 shots for the other and it's just 1 dose for the Johnson and Johnson?
Oh yeah, good question. Okay, so the Johnson and Johnson vaccine, the efficacy is about 66.1%. It has shown that those who do contract COVID, it is nearly 100% at keeping those that contract COVID out of the hospital. Okay. So part of the goal of these vaccines was to decrease the burden on our hospital system so that people could get proper care of any type of care that they need. The Moderna and Pfizer, they will argue this, but they are approximately, one's like 94.6 and the other one's 95% effective. That's why I'm saying they'll argue with that tiny bit of percentage, but they are both about 95% effective. They are 2 dose. The reason why that they wanted to make sure there were 2 doses was to ensure that our immune system had enough of a booster. So typically when you get a vaccine, I'll say tetanus, you get your vaccine, you get a booster 10 years later, right? Well, because we were in a global pandemic, they wanted to be able to give that booster quicker to increase the efficacy at a quicker rate. So previous vaccines, at least I'll say in my lifetime, have not needed to stop a pandemic. So this 2 dose, 3-4 weeks apart is a little bit different. It's almost like a childhood vaccine.
Right.
Right? So, but yeah, that's why that was a 2 dose. Johnson and Johnson was a 1 dose. I've heard things that Johnson and Johnson eventually might offer a 2 dose. I don't know if that's true or not, because again, thinking global pandemic, right? We were in an emergency situation. We wanted to get vaccine out to people who wanted the vaccine. So their EUA was for that single dose so that it could reach more people more quickly.
Okay, so in regards to booster shots, Do you know of any timelines that are, that are circulating, or if you can mix the shot? So I took the Moderna. Would I be able to get a Pfizer booster in a year, or how would that work?
Yeah, good. That's something that I read about almost daily because I think it's ever changing. So I will say that before I answer that question. I think boosters with vaccines are just kind of common. They happen. Whether, again, it's 1 year, tetanus is 10 years. We don't really know the interval of time in between that. I'm expecting a booster to occur. I've read that in terms of boosters, they are working to make sure that they are more efficient to any variants that are coming out. So far, both Moderna and Pfizer have been successful with the variants that are currently out, but they're trying to plan for other possible ones that could come up. So I've heard that these boosters could be a little bit different than the vaccine you received. So yes, I have also heard that it might be possible. So I also received Moderna. And I've read that trying to match Moderna and Pfizer again, right? Like, so those who received Moderna get the Moderna booster. I've heard that they're trying to make whatever the booster may be more universal. So it won't matter what you got, because that would be chaos. If that was something else we needed to do. And it just, truthfully, it's another availability and access thing. So I think they need to work very, very hard to make sure that it is a universal vaccine for access. Just throwing that out there.
Okay, so can you speak to the importance of, can you speak to the importance of people getting vaccinated, like, so to where the virus is not spreading or mutating? Because I know you guys aren't here to, promote either way. You're just here to give the information. But, can you speak to the importance of a cluster of vaccinated people and how it can, stop the virus?
Sure. So, yes, I am not here to tell anybody what to do or to make any decisions for anybody. I really am not. I feel like whenever someone is comfortable, they will know. And that is when they will feel comfortable. And when that time is, if at all, that's up to them. They have shown, Nasha and I work intimately with long-term care facilities in the area. And we have seen the miraculous improvement of the residents since really the beginning of the year. So we had facilities that started getting their first dose, the residents, late December.
Yes.
Right? Late December, I would say. It has been the cases and outbreaks in our facilities are almost, I don't, knock on wood, it's almost rare, right? You get a random case. I will say that there's a higher vaccination rate among the residents than there are the staff. And when there is a positive that pops up, it tends to be a staff member. So if that tells you, and we haven't had residents that have also popped up positive, even though they've been exposed to people who have tested positive, right? So I feel like that's a really good environment to make the argument that these vaccines are working. And this is a demographic that they have severe comorbidities that they are also dealing with, right? These residents in these facilities. So that right there, if you could take one long-term care facility and kind of look at it as its own little entity, that those residents are now have proven to be safe 6 months. We're 6 months in now, and they are going out, they're being exposed to family, They are being exposed to the staff, right? A lot of restrictions have decreased, and we have not seen an increase in cases.
And
Well,
then
that's
too, it's also helped with their morale. So just their general mental health and well-being has improved significantly. And as we all know, when you're happy, your immune system is boosted. So that just having that security, having that knowledge, and being able to come back in contact with their family, go out, have outings, have visitation, has been a tremendous relief for a lot of the facilities that we've been in.
Have a
right.
hug.
Well, that's actually very reassuring. So I did get one question, and she wants to know about the vaccination interfering with mammogram results if it's taken too close. Can you speak to that, Dr. McBride?
Sure. Yeah, I've seen things, various things that they are looking into women's health and different side effects that might be correlated with various things that pertain to women's health and the vaccine. There hasn't been anything that I have seen that has been substantiated in terms of mammograms or anything regarding those types of topics. I'm trying to think from so vaccines, here we go. Nasha's like, I've heard this before. Vaccines are essentially, in my brain, inactive ingredients and active ingredients. So the active ingredient is that spike protein, that piece of spike protein, okay? The inactive ingredients are pretty standard amongst all vaccines. So you have salts, you have sugars, you have preservatives, you have the things that make up the majority of the vaccines chemically, right? The composition. What is different amongst those is really kind of where business comes into play. So I'm Moderna, Nasha is Pfizer. We both have a sugar and a salt in our vaccine because that's what you have to have. But she's going to have one and I'm going to have another because business, proprietary information, all that kind of stuff, right? So really kind of thinking about both the inactive and what I consider the active ingredient, that spike protein. I truly cannot come up with something that would interfere with a mammogram. Not saying it's not possible. I don't know everything. I will not pretend to, but really thinking historically on vaccines and their composition and then what that spike protein is, I do not see a correlation there.
Okay, and what about for pregnant women or women that are trying to conceive? Have you has there been any research on that?
So they have started to include women who are pregnant and or women who are trying to get pregnant in their studies. If you think about at the beginning of the trials, both COVID and Moderna, they wanted to start out with the least number of variables possible. And as more data came in, they started bringing in different variables. And one of those things was women trying to get pregnant or who were pregnant. Pregnant women have, over the course of these past several months, gotten vaccinated and have given birth. And again, with consent, they have given samples of blood of their newborn to the scientific community. And they've actually shown that there are antibodies against COVID in the newborn that the newborn received from the mother who received the vaccine. So there is a little bit of protection for the baby. So the things that I have seen in terms of being vaccinated, again, speak to your obstetrician, right? But I have seen are positive in terms of being vaccinated as a female who is either trying to get pregnant or is currently pregnant.
Okay. And just to circle back to the mammogram question, based on, your expert opinion, you don't see anything that would show up that could skew a mammogram result?
No, I really don't. So, again, if I'm going off of those ingredients, I know that when you receive a vaccine of any kind, you're going to have an immune response. You want your immune system to what they call mount an immune response. And even when your body goes through that, right? So it's kind of like, whoa, what are you? I need to identify you. I need to figure out what to do with you. I got to get rid of you. I don't physically can think of something that would skew a mammogram.
Okay.
But again,
okay.
everybody's different. So,
right.
But I really don't.
Okay. Don't have any other, I'm looking to see if there are any questions.
Oh, okay.
Yeah. Are there any known side effects regarding the vaccine in teenagers? So are there any like documented side effects?
So I break down side effects in terms of long-term and short-term. So short-term side effects, I think of how you feel after you get a vaccine. I will speak about my experience. So I got Moderna, 2 doses. My first dose, I had like my arm was sore. Like I woke up, I must have rolled on it in the middle of the night, and I was like, oh, hi, I got a vaccine the day before. Other than that, I really didn't experience anything with the first dose. Second dose, again, arm soreness, and I was tired. Like someone gave me a full dose of Benadryl tired. Like if I wanted to stay awake, I couldn't fight it tired. And that lasted for a good day. And then I woke up the following day, and I was okay. I mean, I went to work. I was good. I just slept a lot over a few days. So I think of in terms of short-term side effects after receiving the vaccine, they have seen kind of things across the board of all ages. So extreme fatigue, arm soreness. Some people have developed like a little bit of a red rash around the injection site. You might spike a low-grade fever. So therefore you might have some chills and sweats, but all of these things should subside after about 24 hours. None of the side effects from the vaccine, the immediate side effects, should look anything like COVID though. So you shouldn't have a cough or difficulty breathing, anything like that. Then I think of long-term side effects. So unfortunately, we are only not even a year into the COVID vaccine, right? So in terms of long-term side effects, I go back to the research and the science. They are using, again, very known and widely used ingredients in vaccines that have been used for as long as we can remember. There haven't been many changes with vaccines since COVID, right? So all that's been pretty standard. And again, the new thing is that protein, that spike protein, I keep saying that, spike protein, and there's not really anything there because its job is attachment. So there's no genetic material, there's no viral DNA, anything like that that's inside of that vaccine. So in terms of long-term side effects, I then head back to all of those ingredients that have already been readily used for quite some time. And therefore, I would feel like there probably won't be any long-term side effects. Again, if I'm looking at science and research in what we have used over decades.
Okay, so so people who have had COVID, it's said that once they recover from COVID, they have antibodies. So could you catch COVID again if you are not vaccinated? And then the second part of that question is, does the vaccine make you immune to COVID?
Okay, so yes, you can get COVID again if you've had COVID. Towards the beginning of Nasha and I working together and doing contact tracing and things like that, you started to meet people, I'll say, and hear about people in October, November, December that were like, I was like sick like this in March and April. Like, why is this happening again? Like, I've already done this. Why? Well, they finally concluded that most people only have antibodies to COVID after having COVID for about 90 days. So there was about
So
a
it wasn't the
3-month
6
window.
months. Okay.
No, so we would say, per the CDC, that after about 90 days, you are susceptible of catching COVID again. And it was probably late summer, early fall of last year when those cases started to happen again, where people were getting reinfected. And unfortunately, a lot of those people who were reinfected, their second time with COVID, their symptoms were more severe, which was interesting. Again, that varies, but kind of if you look at it across the board, they would say, I feel worse this time. The first time wasn't that bad. In terms of the vaccine, again, why that 2-dose, in my opinion, is so novel and such a good idea is because having those 2 doses, Pfizer released, I believe it was in April, end of March, beginning of April, that the individuals who received Pfizer had very high antibody levels at 6 months because you have that first dose and then you essentially have that booster 21 days later. So that vaccine is giving you a longer lasting immunity than actually having COVID. Interestingly, though, like last week, they said individuals who had COVID and also are fully vaccinated, they have done preliminary research that those individuals probably have a much longer lasting immunity than people who have just been vaccinated. Because if you think about it, the more times you're exposed to something, your immune system is able to become more sophisticated. It can respond quicker. It can respond harder. Like it can mount a better immune response. It's ready. But something like COVID, you don't want to be exposed to multiple times. So you don't take that chance. So I was like, well, that kind of makes sense. So those who have had COVID and are fully vaccinated, yay. I don't know, not for having, but that's a bad way to say it. But I'm just like, at least there you go. A little extra.
But the vaccine does not make you immune to COVID, correct?
No, it doesn't make you totally immune to COVID. So both, again, Pfizer and Moderna are about 95% effective. There have been people who have been vaccinated, fully vaccinated, who have tested positive for COVID. Interestingly, those individuals either had no symptoms or felt like they had a cold for like a short day. I'm talking like 24 hours. So did it completely keep you immune from COVID? No. Did it keep you out of the hospital? Did it prevent you from spreading it to other people? Yes. So that's a good thing. That vaccine did work. Because I think of, let's say you were still exposed but had not received the vaccine, it might have been a worse experience for you and for other people that you came in contact with.
Okay, so we got another question. Is there any risk from the COVID vaccination if you've had allergic reactions to the flu vaccine or any other intravenous things in the past?
So that's a good one. Depending on what the source of your reaction was, because there might be similar ingredients, I would argue, with the flu vaccine and a COVID-19 vaccine, depending on what type of reaction you had. So I would most certainly make sure that I go to my primary care or a specialist, someone that I trust and I see semi-regularly, and talk about the reaction that you had, because more often than not, the ingredient in a vaccine aside from COVID, like I'm saying, like previous vaccines, they can tell which ingredient it was. So for instance, if you're allergic to eggs, they tell you not to get the flu vaccine. You actually get the flu vaccine as a nasal spray because the flu vaccine contains albumin, which is found in eggs. So a lot of times they can tell you based on your reaction what ingredient that might be, and therefore they can assess if you should have the COVID-19 vaccine.
Okay. And looks like I think we have probably about 13 minutes left. And so if you could just discuss the efficacy of the vaccine in preventing death and serious illness and hospitalization.
Sure. So all three, Moderna, Pfizer, Johnson & Johnson, are close to 100% at keeping you from experiencing severe illness. So keeping you out of the hospital. So yes, the vaccine was most certainly created to keep us as individuals safe, to keep those around us safe, but it was also there to help decrease the burden on our hospital system. So there's so many reasons why these vaccines helped, right? So people felt the help of the vaccine in many, many different ways. So again, all three are quite close to 100% of keeping you at a severe illness, being hospitalized, ventilation, things like that. Not saying you can't contract COVID, not saying that you wouldn't be asymptomatic or have cold-like symptoms, but having those severe times with COVID. So it's pretty impressive.
So explain, or could you speak to this herd immunity that we hear about? And some people say, well, I'm not going to get vaccinated, I'll wait for herd immunity. So can you speak a little to that?
Sure. Nasha's smiling because we talked about it yesterday. So I saw her smile. I was like, I know what she's doing. So herd immunity, I will start out by saying, so the theory of herd immunity is that you have such a large percentage of population that has been vaccinated that a virus or a disease is unable to spread throughout that community because so many people are vaccinated. You're keeping those who are not vaccinated safe. Okay. Where I feel like media and other things went wrong early on was giving a number to herd immunity. So everybody heard 70%. We need 70% and then we're fine. So herd immunity, Nasha, it's kind of like a unicorn. A unicorn in the sense that there's no specific number that we need to reach. Like there's no goal number to reach and then miraculously we have herd immunity. Because everybody's community is very different. So who you live with, the places that you go, where you work, and other people you interact with is so very different for each of us. To me, herd immunity, there are going to be people who are unable to take a COVID-19 vaccine, at least the ones that we have right now. So they might be allergic to an ingredient, or they might have another illness that they are fighting, and therefore their immune system is not strong enough to receive that vaccine. So those are the people I feel like we as a community are trying to protect with herd immunity, those who really cannot get the vaccine. I understand and I completely respect that there are going to be people who choose not to get the vaccine. And therefore, the rest of us do need to be vaccinated if we are comfortable with it to protect those individuals as well. Like, I feel like as a society, that is what we're meant to do.
Right.
If you think back in the news, though, I go back to that 70%. And then a little while later, they're like, just kidding, 75%. No, maybe like 80, 85%. The last number I saw, they said upwards of 95% would need to be vaccinated for us to achieve herd immunity. I feel like I'm the bearer of bad news with this herd immunity. But the other thing to take into consideration is herd immunity is something that takes a while to achieve. So we have individuals who started receiving vaccines early, mid-December of 2020. We have individuals who are just being vaccinated today. And in the world of herd immunity, those 6-7 months, it's a big time frame, especially if you're talking about the potential of, at least for the next foreseeable years, an annual booster, right? So our timeline is a little bit stretched based on how the vaccine was administered, like when it was administered for people. So I think herd immunity is something that is achievable, but it's going to take not only a percentage of people, but also time for us to be able to achieve that.
Oh, well, thanks for clearing that up. And so recently the CDC and other states start relaxing mask mandates and start easing restrictions. So COVID is still, it is still out there, and we need to be mindful of that. So what do you say to people who are not vaccinated or are still hesitant, but when they're still going out in the public, like, going to Target, going out to restaurants, when mandates and restrictions are being lifted?
Just like the vaccine, I will say masks are a personal choice. Obviously, I try to be respectful of businesses. If a business asks me to wear a mask, I wear a mask. I wear a mask.
Mm-hmm.
I think I will forever wear a mask, so that
right.
I forgot how to smile because you didn't have to for a long time. So right. It's like my safety net now. No, I would always say, if anything, before the vaccine became readily available and people were getting it regularly, right? It is proven that those masks and that social distancing and that hand washing, we did not have a flu season.
Right.
So those things worked. So I would always recommend wearing a mask. I would always recommend being mindful of social distancing. I would be lying. I go into the grocery store, and without even really realizing I'm doing it, I take a step back from people now. Like, I'm probably so rude. People are probably thinking I'm so rude. But I just naturally go, I need some space. I need some distance, because it's been like drilled into our heads these past 12 months, right? But you are always safer. You are always keeping the people around you safer when you wear a mask. Mm-hmm. When you social distance a little bit, when you make sure you keep up your hand washing, things like that. So I still wear my mask, probably out of habit at this point, right. and privacy. But yeah.
Okay, so we have probably about 5 minutes left, and with that being said, I just want to give you any last thoughts, Dr. McBride, any last advice or final words that you'd like to tell the community that's watching?
Yeah, no, so thank you for letting me be a part of this. I really, really appreciate it. I hope that I answered your questions. If you ever have any other questions that pop up, I will be more than happy to answer them. Just let me know.
Absolutely.
I'm still here.
Absolutely.
But pray, think about it, speak with people you trust, your family, your friends, and when in doubt, pray. I mean, truly, I feel like speak to a doctor, speak to somebody that you trust, and hopefully we all should be non-judgmental of whatever somebody is comfortable with, and hopefully everybody can find that person to be a support system for them. And if you choose to get the vaccine, you will know when you are ready.
Okay. Thank you. Thank you
Yeah.
so much. On behalf of Pastor Johnson and New Zion Missionary Baptist Church family, we would like to thank Dr. Jennifer McBride and my bestie, Nasha Snipes, for participating with us tonight. This has been so helpful. I know my church family learned so much. There were tons of questions, and we will definitely be reaching back out to you again. I know we will. So thank you again, and have a good night.
Thank you.
Thanks. Bye.
Bye.